Do you play golf and have issues with your elbow, your forearm, your wrist, or your shoulder? All of those things are related. Just this weekend, I had a friend that was talking to me about his thumb, and he's got isolated pain in his thumb, but it started in his elbow. This is about 6 months ago. Started in his elbow, went all the way up, and then he rested, got rid of it, and then it came back with a vengeance in his elbow, and then now it's isolated down in his thumb. All of it's related. We're going to go through how to fix it in this video. My name is Jonathan Ruzicka. I'm a doctor of physical therapy. I have a clinic in the Woodlands, Texas, and we work with golfers all the time that are dealing with problems in their arms, in their hips, in their back, and we work on it consistently and we fix it for them. So I want to go through this video with you on exactly what we do so you can fix it yourself. Make sure you hit the subscribe button and the bell icon. I don't want you to miss out on any of the content we're putting out. This stuff actually works. Elbow pain can be pinpoint right in this area. A lot of people describe that, but then it can also move up or it can move down the arm. And so we want to describe exactly what the anatomy is and why it keeps moving around for a lot of you guys. Along with going up and down, it can be on the inside of the elbow or the outside of the elbow. They call it little leaguer's elbow or golfer's elbow when they have it on the inside, and then tennis elbow when they have it on the outside. What we've seen in the clinic is that it doesn't matter. We'll have golfers that have tennis elbow and tennis players that'll have golfer's elbow. So we really want to treat it three-dimensionally because everything's interconnected. We have another video that we're explaining on exactly how the body's interconnected, but on this, we're going to focus on exactly how we fix it. For long-term resolutions, we're always looking to redistribute stress. So our body gets up in the morning, we get up against gravity, and gravity is beating down on us. So the more efficient we are at taking on that stress and redistributing it to bigger muscle groups and maintaining mobility in the right areas and maintaining our strength, that's going to dictate how long-term all of our recoveries are, because you're going to run into a hitch. Here and there, you're going to get hurt. We got to know what we need to do to get out of that and then how to keep it fixed so that we can prevent most of those things from happening. When we have tissue injuries, when we have tendonitis and problems like that, it's always best to think about it like your shirt. So if we have a corkscrew, we got twisted up right here, we're pulling on it. These threads are getting irritated. We have a cut right there, right? So cuts on the outside of the body and cuts on the inside of the body are the same. We just can't see them. So if I have tight tissue right here, I'd be pulling on a cut. So think about the same thing with a cut. If you had a cut on your arm and you just pulled the skin like this, you're never letting it close. And that's how we need to think about on the inside of the body. If we have a corkscrew, if we're really tight in this area, we're constantly pulling on that, and that creates this problem of tendonitis where we have frayed tissue, and that frayed tissue never gets to cinch up. So we're always looking to loosen up the tissue above and below, and on the front and the back side. We're staying away from the area where the cut is, where the tear is. We don't want to go into that until after 2 weeks. Where do we need mobility? We need it in the shoulder blades, we need it in the thoracic spine, and we need it through our hips. Those are the areas where we get stiff. If we sit for long periods of time, then our hips start to get stiff and our thoracic spine starts to get stiff. So we're going to put together programs to maintain mobility in the right areas. When we're focusing on wrist problems, thumb problems, and elbow problems, we have to focus on the space in between. A lot of these muscles that connect on the elbow, on the outside and on the inside, are coming all the way down our hand to our wrist and even to our fingers. So these muscle bellies, that's where we're going to get the most give. So we've got to talk about what are we going to do to get give in these muscles so we stop having that tension. The first thing that we're going to do is a forearm rollout. So I'm going to get on the inside. Remember, whether you have pain on the outside of your elbow or on the inside of the elbow, we want to do both sides. And we're trying to make it as efficient as possible. So when I go in right here, I'm actually going to get down on a countertop, something hard. So I put this right here. So this piece of foam makes it a little bit hard. I'm putting pressure down through the forearm, and then I'm gliding up. So I'm extending my wrist because these are my wrist flexors. So if I extend my wrist, then they're tightening up, they're creating tension. I shouldn't be having pain. I don't want you to reproduce the pain in the elbow or in the wrist. We're going to shorten that range of motion. If there's a certain point that you feel it more, we want to back off. We want to stay under that point because we're not trying to irritate that. We're actually trying to give it some slack so it can actually heal. So I'm getting down in here, and I always think about just doing it for a minute, gliding in here. We always break it up into 3 different lanes. So the inside, the middle, and then the outside. We want to get into those muscle bellies and loosen it up. And for the first 2 weeks, I stay away from the area where I'm having the actual irritation. So I'm digging that out. I do it for a minute. Now I go on the back side. I'm going to put this right here on my forearm, and I'm going to get up against this wall. We're putting pressure through it. So doing it up against a door might be better for you at home. We don't want to put holes in the drywall. So I'm going to do it gently right here. We have put in holes in the wall here and at home. So I'm getting right here up against the wall. And then I put my hand on the outside. I want to guide with my fingers underneath the bottom of it, so just in case the ball falls, I can catch it and I'm not chasing the ball around everywhere. So I come in here. You can use a golf ball, lacrosse ball, you can use a baseball, really, but a lacrosse ball works really well. A golf ball is going to be more pinpoint. It's going to be smaller. Now you'll see that when I'm doing this, I'm pushing into the wall and I'm going to do flexion. So I want to be very specific on that I'm going into flexion, so I'm lengthening those muscles as I come forward and I'm digging into it. You can see that the ball's moving around a little bit, so I'm going to drop it back down. I want to respect my shoulder too. I don't want to be curled up like this. I want to actually drive my shoulder down and then gliding forward like this. And I'm loosening it up. Remember, I'm doing these lanes right here. When I'm rolling out, I do about 1 inch at a time. So I'll do 1 inch here for about 5 swipes. I'll do 1 inch here for about 5 swipes, inch, and then I'll come down and I'll do it because your forearm, depending on how long it is, we don't want to be trying to go through the entire forearm in one swipe. It's just very inefficient. Now we got to work on thoracic mobility. We're redistributing stress up to the thoracic spine and we're going to activate those muscles. So we got some tools over here so you can see it. So if it's hard to get up and down from the ground, then we don't have a hard surface. Then we need to create a hard surface with our bed. And so this piece of foam will work pretty good. And I can use this foam. I can just use a towel roll. If you're on the ground or if you're on a stiff surface, then you can use a towel roll in the beginning. And we want to progress to where we start using a double lacrosse balls. That's our challenge, but we can't be going into neck extension while we're doing it. So when I set up right here, I don't want to have too much give in the bed. So I'm going to lay down like this, and now I'm rolling back and onto my back. So I just felt the pop in my back. What we want is popping in your back. We want it to loosen up. Now you can see that my head's up in the air because I just raised it up. So I'm going to put something just like a pillow underneath my head right here, and I chin tuck. And I'm just breathing and relaxing in this area. So we're looking for load, long duration when we do this. We're increasing mobility through the thoracic spine. I'm going to get right here, put my hands underneath my head, and then I'm going to just rotate. And so I'm going to do 5 rotations each way. So I'm working on rotation and extension in the thoracic spine. Remember that none of this stuff should hurt. It should be uncomfortable, but it shouldn't hurt. Now I'm going to move down about 3/4 of an inch, about an inch, depending on how tall you are. We're going to find 4 different spots, and we're going to do that same routine through each one of them. Now think about this as your shoulder blade. I want to be below the shoulder blades. I want to be at the base of the shoulder blade. I want to be close to mid shoulder blade and then close to mid upper shoulder blade. And I'm going to do those 4 different spots. And I'm going to do this consistently. I've got to get that thoracic mobility so that I can redistribute the stress up there. Remember that we're looking for long-term outcomes. Somebody can shock you or use some E-stim on that area, get rid of the pain. It'll help you for a day or two. We're looking for a long-term. How do we get rid of this long-term? Now, number 3, we do this cross stretch. So I'm actually going to get up on the table. This is slightly dangerous. Don't do this at home. I'm going to get up on the table and I want to lengthen all the tissue. So we look at anatomy trains. We look at lines of tissue. Our body's a pulley system. We need to lengthen all the tissue together. So I'm not doing isolated stretches like this. That's just pulling on the area that's injured. I want more movement to come all the way across the chain, and I want it to be bilateral. So when I come up like this, I'm going to roll back. You can do this on a bench. You can do this on a ball. You can do it on anything that allows you space right here. So I'm going to come right here, drop my head down, chin tuck, and I'm pushing my elbows up, driving my shoulder blades down and back, away from my ears, and then I'm extending my wrists and maintaining this position. Remember that I don't want to be jutted up in the air. I want to chin tuck as best I can, and then I'm holding this. Now with these, they're hard to get into, so we actually do them for a minute. I'm holding this way, and then I'm going to flip it for another minute, and I'm going to tilt my arm down. So I'm going into flexion. When I do that, it changes the stretch. So when I do that, I'm actually feeling it more in my bicep and my extensors. And when I'm here, I feel it less in my bicep, and I really feel it in the front of my forearms and my elbow, and I feel tinglies in my hand. If you feel those tinglies in your hand, that's okay. Just come out of it a little bit and then go back into it. It's not going to cause damage to your nerves. We're just lengthening the nerve, and it's fairly extreme, but it's really effective. Now, number 4 is we're going to do threading the needle. So I'm coming here. We've talked about this a few times on the channel, but it's a really effective stretch for the back of my shoulder blade. So I'm coming up through here, dropping my head down, and then pulling back, and I'm pulling back with my hips and my rib cage. And I'm doing the same thing, just breathing through it. Typically, I do 5 breaths on one side, and then I'm going to switch sides and do 5 breaths, and I'll do 2 rounds of it. I'm just loosening up those shoulder blades, loosening up the lats, and I'm increasing my ability to take on stress in those areas. So now I've opened the front of my chest and through my arms. Now I've opened the back of my chest, back of my rib cage and my thoracic spine, all the way through the arm. So you see that we're getting these chains of tissue, and that's why it's so effective. We're not isolating things. We're really making the movement more diffuse through the body. Number 5, we're going to do scap squeezes. So I'm actually pulling down. Now I can do this external rotation right here. I can go really far. But if I just want to pull my shoulder blade down and open my chest up, then I stop right here. So with this movement, I don't need a ton of resistance. This is going to be a little bit tough. I can take the knot out of it and make it less tough, and then take the band away completely and work on this. So depending on where you're starting, I've seen a lot of programs in the past where people start too hard. They start with level 5 when we should start with level 2 or 3. So start where it's comfortable for you and it doesn't reproduce pain. That's how you'll be able to pinpoint where you should be starting. Don't reproduce pain. Start with the easy stuff. Give yourself 3 or 4 days to acclimate to it, and then start adding some resistance and start at the lowest level. We want to build this back up. And remember that those first 2 weeks, we're trying to get the inflammation under control. It's okay to start nice and easy and not put too much pressure on it, because we want a good long-term outcome. So what I'm going to do is I'm coming here, pinching my shoulder blades down and back, and I'm going to do 10 of these, just opening up my chest right here. You can see it from the side. I'm isolating that my shoulder blades are doing the motion. I'm not doing this. That's external rotation. That's for the rotator cuff. This is for the shoulder blade to open up. So, and then from the back, pinching those shoulder blades down and back, just doing 10 of them, firing up all the right muscles. See, I'm starting to sweat and I don't even have any resistance on me. So I'm going to come right here and I'm pinching those shoulder blades down and back. You see, I'm not going that far. It'd be hard to go much further than this, but with this band, but I'm going here. I'm getting the full load of what I'm trying to do by pinching my shoulder blades down and back and having resistance on it. And I feel it in between my shoulder blades. We should be feeling it right here. So we're just doing 10 of those and we do 2 sets. Number 6, we're going to do Batman. So we call them Batmans. They're called eyes in some other programs, but Batmans is easier to remember. We're going to do external rotation. So if I'm coming here, I'm pinching my shoulder blades down and back, and I'm turning my thumbs out to the side, and I maintain a chin tuck. I can do this in standing, and you should practice in standing first so that you can get the movement down correctly. And I'm just holding that position for 10 seconds, and I'm going to do 10 of them. Now, as we progress, after we've done 3 or 4 days, we got acclimated to it. We know we're doing it right. Then we're going to get onto the ball, and I'm going to drop my chest down. I want to keep my belly tucked, my chin tucked, and then I'm going to externally rotate right here, and I'm pinching my shoulder blades down and back, doing a 10-second hold, and then I'm going to totally rest coming out of it, and then a 10-second hold. So my palms are facing out. This is really important because I've had clients in the past that end up doing this. So the palms facing out is really important because that's what's going to get our shoulder blade to set down in the position that we need it to. And I'm going to maintain this position for 10 seconds. Chin tucked, belly tucked. Remember, it's hard to remember. There's a lot of cues. So it's okay to go back through the video and figure out, make sure that you're doing all the cues. So belly tucked, chin tucked, that's going to create co-contraction. And that's what we're looking for. If we want to build stability in the body, we've got to be using our deep neck flexors right here in the front, our scapular retractors in the back, our abdomen, and our glutes. And that co-contraction across the body keeps us upright against gravity, and that's what we're looking for. Now, that's big globally. That's thinking about things, the big picture of what we're looking for. We need the mobility to fix this injury. We need the mobility through those areas, and we have to put stability in there so we can redistribute that stress. If you need more guidance on how to use the hips and what our hip rehab, how we get those engaged in our swing, make a comment and let us know. We can put together that video for you, and it's going to have a warm-up routine on what our golfers do and how they stay out of pain. Remember, with soft tissue work, we're looking for length. We always do soft tissue work first. We're loosening something up, and then we get blood flow to it, and then we actually lengthen it. That's how we get long-term lengthened muscles, and that's how we get our chain moving around, and we do it consistently. This should be done on a daily basis, especially if you've had a history of these problems. On a daily basis, we want to loosen up that whole chain of tissue and then get blood flow to it and lengthen it. And that's why I'm the king of 10-minute workouts, because I make sure I get something in for 10 minutes every day as long as I can. Sometimes I'm going to miss, but don't beat yourself up for missing. Just get right back on it the next day. Make sure to hit the subscribe button, hit the bell icon, get notifications. We're going to be putting out a ton of content for golfers so you know exactly what to do to stay out of pain. If you're having any other pain issues, then check out the videos here on the page. We're going to go through knee, hip, low back, sciatica, all of those issues that our clients deal with. We're going to teach you how to fix that. I'll see you in the next video. Get mobile and stay active.